stage Sonali Patel from Chapin Hall, Carla Silva, the Executive Director of the Alliance for GLBTQ Youth in Miami, Florida, Megan Gibbard, Coordinator of Regional Effort to End Youth and Young Adult Homelessness in King County, Simon Costello, Associate Director of Children, Youth and Family Services at the LA LGBT Center, and Jerry Peterson, the Executive Director of the Ruth Ellis Center. Round of applause for these people, please. So this part of the program is really exciting because I'm going to do a really quick intro, and then you're not going to hear from me again. You're going to be able to engage in a conversation. Sorry, pretend like you didn't see that. You're going to engage in a conversation with these folks about the work they're doing, moderated by Sonali, because they're doing some amazing work. So again, we're going to talk about how folks are collaborating across systems working towards the 4 core agreements. So you may be thinking the 4 core, what? The 4 core agreements, okay? So they are, not agreements, outcomes. Have I been saying agreements this whole time? Okay, I get it confused with that book, The 4 Agreements. Does anyone know that book? If you don't, it's equally important in guiding our work. I'm just going to say it. Go read the four agreements, then look up the USICH 4 core outcomes. It's in order now. 4 core outcomes: stable housing, permanent connections, education, employment, and well-being. So if any of you are like, don't worry. That's what this panel is about, figuring out how to work towards that. But we can't do it alone. We need to collaborate. That's why we got these folks on the panel. But sometimes collaboration is hard to do. Some reasons that people might not collaborate is they fear lack of resources. They don't have the resources. Or people are worried that they're going to end up carrying an unfair burden of the workload. Or quite frankly, sometimes our egos just get in the way. And when collaborations go wrong, it can feel really rough. Yeah. But they don't always have to be out of reach. And when collaborations work, it's really, truly amazing. And we are stronger together. Reasons to collaborate right here: shared vision, shared resources, solidarity, and greater impact. Like what they're doing at the Ruth Ellis Center, where their Family Preservation Initiative is the first intensive initiative in the U.S. seeking to engage, preserve, and support families with LGBT children and caregivers that are under investigation or otherwise involved with the child welfare system. At the LA LGBT Center, they are engaging lots of partners in their employment program, and a great example of how to apply an LGBT lens working towards this goal. So ask Simon about the career continuum and how they incorporate that into the work there. In Miami, the Alliance for GLBTQ Youth is a service partnership involving 6 different agencies, and with a couple of programs that have developed out of that Carl is going to talk to you about. And King County has truly led the way with their comprehensive plan to end youth and young adult homelessness. Megan Gibbard can break it down like nobody's business about how to do this kind of work in your community. So I'm really excited for you to hear from these folks today. I'm going to step off and let Sonali take over.
Great. Thanks so much, Dana. All right. Well, good afternoon, everyone. I know this may feel like nap time, where we've gotten a little away from lunch here, but you've got a group of 4 exciting folks up here. And so what I want to do is I'll start off with a few questions just so you all get a real sense of what Jema outlined in terms of what folks up here are doing on the ground day to day. And then, we'll certainly want to hear from you all and engage to hear what these folks can really answer for what's really pressing in the work that you all do. So let me go ahead and start off with, the wonderful slides where it was very clear that everyone up here is collaborating across multiple sectors, collaborating with a lot of the usual suspects as well as, the folks that may not come immediately to mind. And I think it'd be great to sort of hear a little bit about if there's been anything surprising as you've looked to reach across sectors and really do these collaborations, and both good surprises as well as some of the challenges that you face. So I'll open up with Carla, if you want to go ahead and start off.
Sure. So what's actually pretty special about my organization is that it was born out of a community needs assessment, because Miami-Dade County didn't have any youth programming services specifically designated for LGBTQ youth or their families and communities. And so early on, we actually learned what it was that our young people needed in order to feel safe, in order to be participating in schools, and really to be affirmed in their identity. They fortunately gave us a really clear statement of what they needed. So as a result, a bunch of us came together and we created a service partnership. After a long time, what I realized was that housing was the primary issue that we weren't able to bring on. And actually, let me correct that. We had it on early on in the beginning, and as funding sometimes works, and so I'm learning much more about funding and how to work efficiently, let's say, with funders, is that at the point of when we started our work, we actually had the only youth shelter in our community participating. And what we learned was that they weren't drawing down any of the funding that was actually brought in to house young people. They were housing young people, and we were serving them through care coordination and counseling and prevention education, all kinds of things. But they weren't actually drawing down. And that was because when they were experiencing homelessness and coming into shelter, they weren't coming out. Right? They had just been kicked out of their homes, they were bullied at school. They made a very smart, informed decision about who and when they were going to come out. And at that point, they did not do that. And as a result, this particular shelter, which is the only shelter for youth, they decided that the way that they denote funding is that they would do it at point of intake. So we lost all the money for that. And that's what happened early on. So as a result, a few years later, and really working collaboratively with the folks still in the room, which were largely all LGBT organizations, what we decided to do was refocus our energies and our priorities. And as a result of that, we created a brand new, a Project Safe initiative to really just focus on the actual experience of homelessness. So one of the surprisings is find out where your funding is when it's actually being withdrawn, really important. But really what became the most important thing was the abject lack of data, right? In our community, what we ended up finding was that the continuum of care, which is exclusive of youth in general, forget just LGBT youth, of youth. They didn't consider if you were 18, you were an adult, and there's that 18 to 30 range, they're an adult. So we know that that's not the experience of our young people, where they can maintain safety and actually be engaged or housed. And what we learned was that the numbers were that we had 7, and I was mentioning this earlier, we had 7 youth that were homeless in Miami-Dade County a few years ago.
Problem solved.
I know, right? I mean, we could find, placement for 7 people, surely. The reality was that our shelter, the youth shelter, if you were there, that was congregate care. So they weren't homeless. They were in the foster care system. They're not homeless. They're not counted. And so that was a huge surprise to me. Because and I live in Miami. If no one has been there, it's really sunny a lot. People like to go there on vacation. And so it's really easy to pass as a tourist. Right? And so there's this real invisibility. Like, you can't see them. And they don't engage in services because clearly they don't exist. And they're right on, they don't exist. And so I'll just leave it there for now. But those were the 2 things that I learned really right away that forced me to have to really shift the way that we were going to be working together.
That's great. Thanks so much for outlining that. Megan, do you want to talk a little bit about sort of the collaboration challenges and wins that you've experienced in Seattle?
Yeah, I wanted to highlight 2 things about surprises and challenges in King County. I think surprises, and I want to start just right with young people, that I think all of us in this room have a value and know that young people need to be involved in decisions that impact their lives, right? And I knew that going into the work as well. The leaders in the field knew that going into the work. But I think what I have been surprised by, and I don't think it's just me, that young people are actually involved and should be involved at the front end to shape policy and not just respond to something that's half-baked, right? And when young people do that, it's incredibly profound. So I have been, I think, humbled and surprised by when the Mockingbird Youth Advocates Ending Homelessness and other young people get together at the front end, before anybody has made any decisions. They have incredibly profound, smart, relevant strategies about their own lives. And that shouldn't be as surprising, but I think the nuance and the depth. And I think something I've realized is that young people are actually creating systems all the time because there isn't a system. So young people are linking together services, they're figuring out how to get their needs met. So they are the best people to understand where the gaps are and to understand what needs to happen. So I just want to underscore that. I think we've heard that throughout the day, but that has been very humbling and just tremendous. I think as an example of that, when we did our community plan a year and a half ago, about midway through the process, we pulled together providers and funders and young people to say, hey, we've got these ideas, what do you think, community? And young people had great things to say. But they continued to be involved throughout the next year and a half, and now as we are heading into the spring, where we'll do our plan refresh, young people are saying, great, actually, we'd like to be involved before you start planning, because we have some things we'd like to share with you before you start baking things, and that's what the process will be this time around. So super excited about that. I think a surprise, it shouldn't be. And in terms of the challenge, I think Darla mentioned that collaboration, it takes time, and it's not funded time, and it's tedious. It's a huge effort, and I would say this isn't an answer, but expect that. And there isn't any other way to get it done. There's just not any other way to get it done if we actually want to get there. So collaboration is going to take time. It's going to be tedious. It's hard to find the funding for it, and it's the only way, I believe, to get there.
I look at this through a slightly different lens, and about 8 or 9 years ago in our program, we really started to change the mantra from our regular services to beds and jobs, which now this year when usage came out of the 4 core outcomes, at least we've got 2 of those 4 core outcomes that we're working for. But about 8 years ago, we really started to focus on beds and jobs, because we knew the young people transitioning out of our program, a lot of them would go into new jobs. And we started working in that area, and I guess we started like a lot of people start, and we start by preparing resumes and getting people close for interviews and giving them interview skills. And it wasn't very long before we discovered that wasn't enough. So I think the challenge we had was building a model that worked, because there were no best practices around there. And we were fortunate to work with USC, who were very interested in this work. And they took a model that had been used with adults who had barriers to getting into employment, and they took that model and we adapted it to work with our youth. And it was basically a supported employment model. So now we had a model that worked, and then now we need to see we needed more than that. Again, it still wasn't enough, and we needed collaborators. So we started one by one working with the community and building up collaborators in the community who would help give our young people jobs. And I think at this point we have 54, 55 organizations in the community who are working with us. Not just handing us their position open flyers, because that isn't enough, but actually working with us hand in hand to find positions for our young people, get them in there, put it in a supported employment model where they can succeed and where they can thrive. The challenge was building that model. It wasn't there. It took a long time to do that. We made tons of mistakes along the way. I made some of them myself. The surprise was that the outcomes are incredible. The young people take this program and they run with it, and we really have some good outcomes. So I think that is the surprise, that if you do it right, one by one, you can actually get the outcomes.
Okay, that's great to hear. Jerry?
Well, and for me, I was working for 3 years in Contra Costa County, California, before moving to Detroit last year. And so moving from kind of the mecca of what's viewed as progressive thought and openness to Southeast Michigan and to a relatively conservative state, my biggest surprise was that I think the LGBT movement has moved far enough that there are allies everywhere. There are allies everywhere. Now, they may not be easily found, and very often they are still silent, either because they're afraid or because they haven't found their own voice yet. And so what we did was we identified some state-level leaders in the Department of Human Services who were out advocates for LGBTQ youth in the child welfare system. And I went with them, built relationships with them, and they helped us identify the key people in the local area who we needed to go have private conversations with. And so we did that round of conversations. And we really spent time with those people coaching us on, if you want to build a partnership with DHS, you're going to have to learn our language. Here's the lingo, here's what you need to understand, here's the approach that's going to be most successful. So we did all that work quietly and kind of silently beforehand, of both identifying and working with them, getting them on board, and helping them in that process find their own voice and message, where then they actually started attending meetings and stating things. And so it moved to the point where the head of DHS for Wayne County and her team, we've settled all the basic agreements to do mandatory training for all CPS workers, 250 CPS workers in Wayne County in 2015, and then to embark on a program that will help them identify issues of sexual orientation, gender identity during an investigation. They can then be referred to Ruth Ellis Center for 13 months of intensive services with an availability of 24/7 availability of an advocate to help that family stay together before they get kicked out, run away, or end up in child welfare. But it started with that belief. We've got to know and believe, even if we're in rural areas, no matter where we're working, there are allies everywhere, and they can be found, and there are ways to work with them.
Great. I mean, that was such a wonderful array and critical array of collaborations that I think you all highlighted, from funders to the youth themselves to employers to child welfare agencies. Certainly, in what you all described, that takes time and effort, relationship building. You all clearly also are attached to organizations that have their own missions that you're all working towards. And then to overlay the focus that you all are keeping on the 4 core outcomes that were outlined through USICH, right? So we have stable housing, permanent connections, employment and education and well-being, and there will be a quiz at the end on those 4. Can you share with folks here in this room how you manage to juggle those things? Not that they're necessarily competing, but keeping all 3 of those areas in mind, the collaborations you're building, your organizational missions, and then driving towards those 4 outcomes. What are some of the ways that you all have found to really sort of meet those array of goals that you're working towards? If we want to maybe start in the middle here, Megan or Simon, if you want to chime in.
Sure, I can give that one a shot. I think what's important is, if you're working with organizations and agencies and private bodies, they may not have exactly the same outcomes in mind. The mission may sound slightly different, but if they are complementary or they can be aligned, I think that's where you can have success. Some years ago, we started working with the Department of Mental Health in Los Angeles, and the Department of Mental Health TAY division have some very smart people working there. And their mission, they decided, was to connect with young people who are in need of mental health services. And they brought in all the stakeholders, and they started talking to the stakeholders about how they might do that. And they will tell you they're not in the business of providing drop-in services, they're not in the business of providing housing, but they are in the business of connecting young people in need of services with those services. And through that collaborative range of meetings, which I was a part of, those stakeholders' meetings, they decided that they were going to support drop-in centres and support emergency shelters, because they recognized that if they supported drop-in centres and emergency shelters, we could meet our outcomes, but they could also meet their outcomes. So I think that's a good example where the mission might be slightly different, but they're in alignment and they're complementary, and I think you have to find partners like that.
What I hear from that question is really, so we have agency missions, we've got the 4 core outcomes, we have sort of community-wide data. How do you make sense of all of that? It's just a lot, right? It's a lot. And the work is already difficult, and now we're going to do this big community collaborative process. Like, yeah, right. I think that I just want to underscore, I don't think that there's another way to get there. So no one agency, and this isn't news to any of you in this room, but no one agency can solve youth homelessness in your community. It's not possible. So we have to work together if we want to have the impact. So in some ways, I think this isn't the answer that anybody wants to hear, but if our mission is to end youth homelessness or to even make a dent in the problem and not just to give a couple of kids jobs, which is very valuable, but if our mission is actually to end youth homelessness, it has to be a part of the work that we're doing. I think part of the secret sauce, as Laura Zeiliger said, is to have data, and I think I would add to that, I think part of the secret sauce in a successful collaborative process is to be time limited and pretty specific. So we have 4 core outcomes in King County, which are essentially the hearth outcomes that we've modified to be more appropriate for young people. And we also add disproportionality onto that. So taking a look at how effective our programs are at serving queer youth and youth of color. They are not perfect. And anybody could tell you from our community those outcomes are not perfect. But we got there pretty quickly. And we've been driving towards those outcomes and then measuring our progress on those. So I would say pick something that's not perfect above not picking anything at all. Pick something and start moving towards it, and to do that in a pretty compressed period of time so that you don't lose folks. And just get going, I would say.
For us, the focus really has been on recognizing that in our partnership with DHS, we're recognizing that we have to work with everyone in the system, and we have to stop demonizing people who are rejected. We cannot find common ground. The most critical thing that I believe when we talk about secret sauce is really about its MUA. It's establishing mutual understanding and agreement about what the issue is and what it is that you're going to focus on. What that looked like for us in terms of DHS is that we immediately had, and this is what we were guided by everyone that we talked with, we were immediately guided to say the first thing we would say when we go into meetings is, we are not here to change your mind or your values or your personal beliefs about LGBTQ people. That is not what we are here for. What we are here for is to establish our common ground on the fact that human beings, particularly young people, have a right to safety and they have a right to not be harmed. And can we establish our basis, our mutual understanding and agreement on that issue? And then what does permanency look like? What does increase in safety, reduction in isolation, and permanency look like in that environment? And can we talk about changing behaviors, not ideology, meeting people with their behaviors, where behavior changes so that we can actually create safety and permanent relationships. So